Good afternoon and good morning, everyone, and thank you for joining the webinar, People Who Are High Utilizers Learning Community, Applying Data to Improve Performance and Identify Early Intervention and Prevention Opportunities. We'll get started in a few minutes to allow for additional sign-ins past the hour. Hello, everyone, and thank you for joining us for the webinar, People Who Are High Utilizers Learning Community, Applying Data to Improve Performance and Identify Early Intervention and Prevention Opportunities. This is the fourth and final session in a series of virtual events in our learning community for Justice and Mental Health Collaboration Program grantees. My name is Deirdre Assay, and I am a Senior Policy Analyst here at the Justice Center, and I will be moderating today's webinar. To give you an overview of the webinar today, we'll start with some introductions. Then I'll turn things over to Robert May from the IJIS Institute to review what we have learned in the first 3 sessions of this series and talk about using data for system change. Then we'll hear from Director Michael Daniels from Franklin County, Ohio, and his work with FUSE, or Frequent User System Engagement. And at the end of the webinar, we'll have some time for questions and answers. Before I begin the introductions, I want to display a polling question we have for all of you who are attending the webinar today. This question will help us get a sense of where your jurisdiction is in terms of collecting and utilizing data to affect change. You should be able to see the question on the right-hand portion of your screen, and you can take about a minute to answer it. WebEx will tally the percentages of responses so we can see the results live. We will close the poll in about 15 seconds. All right, and you should now be able to see the results. It looks like majority of you are not yet collecting or are collecting and using that data. So it looks like some of you have not either yet begun or are collecting the data but don't yet know what to do exactly with that data. All right, now to turn to some introductions. We're excited to have 2 panelists joining us on this webinar today. Robert May, Assistant Director, Program Services at IJIS Institute. Robert, or Bob May, has more than 44 years of experience in criminal justice and law enforcement. Bob directs the BJA Prescription Drug Monitoring Program, RxCheck Hub project, where he provides both program management and training and technical assistance, as well as oversight of maintenance and operational support for the RxCheck Hub. Bob previously worked for the Criminal Justice Institute, JBS International, and served as Executive Director of National Task, a professional membership organization representing treatment accountability for safer communities programs. Bob spent 12 years in state and county law enforcement, serving as police lieutenant and chief criminal investigator. Bob is a graduate of the 138th session of the FBI National Academy, holds a Bachelor of Science degree in Behavioral Science from the University of Maryland, and has completed postgraduate work in Criminal Justice Administration through the University of Virginia. Michael Daniels is the Director of Franklin County's Justice Policy and Programs team. He is the point person for Franklin County's Stepping Up initiative and for Franklin County's commitment to the Data-Driven Justice Initiative. Prior to joining Franklin County, Michael was co-owner and co-publisher of Outlook Media, Ohio's progressive LGBT media company, and a frequent commentator in print and on radio and television. He has worked in television media software and as a project manager in California and in the pharmaceutical industry with postings in Indianapolis and Philadelphia. He holds a master's degree in chemistry from Washington University in St. Louis and a bachelor's degree in chemistry and Spanish from Franklin College of Indiana. Thank you both for joining us today. Before we move on, a few housekeeping items. During the webinar, you can ask questions by typing into the Q&A panel at the bottom right-hand portion of your screen. We'll respond to technical issues and questions as we go and keep a running list of content-related questions and hold until the end of this session. For some brief information on the Justice Center, which I think many of you are already familiar with, we are a nonprofit, national, nonpartisan organization that develops research-driven and consensus-based strategies to increase public safety and strengthen communities. We engage in consensus building, original research, policy change, and providing expert assistance at the intersections of criminal justice and behavioral health. We seek to break the cycle of incarceration, improve health opportunity and equity, and expand the knowledge base of what works to improve public safety. The Justice and Mental Health Collaboration Program, as many of you know, supports cross-collaboration between criminal justice and behavioral health entities to support people in the justice system who have mental illness or co-occurring substance use disorders. The Bureau of Justice Assistance is the funder of JMHCP grantees, and here you can read their mission statement. Now I will turn things over to Bob at the IJIS Institute, who will remind us of the material we have covered, and then begin our discussion on applying data to improve performance and identify early intervention and prevention opportunities. Bob?
Thank you very much, and good afternoon, everyone. Just briefly want to tell you about the IJIS Institute. We're a nonprofit alliance, and we work to promote and enable information sharing through technology, use of open standards, and open source software to improve productivity. We were created by the Justice Department out of the 9/11 Commission report, which of course had major issues with lack of interoperability. So we advocate for policies and processes for information sharing standards to improve information sharing across all sectors. I'm not being able to change the slides. Deidre?
Hi, you should be able to advance slides now.
Okay.
I just click on the screen with the slides.
Yeah,
and then feature.
that was it. Sorry, my fault. Focus areas at the IJIS Institute include criminal justice, corrections, law enforcement courts, public safety, homeland security, health and human services, school safety, and transportation. These are some sample of the projects we work on. The ones highlighted, excuse me, the ones highlighted in bold are the ones that are most relevant to today's topic: corrections, reentry, information sharing, justice and health information sharing, health and human services interoperability. These are projects where we develop technology solutions in partnership with industry, and then we make them available to everybody at no cost. So we can promote new ways to exchange information. These are the 4 webinars in the High Utilizer series. This is the 4th one. The first one was focused on identifying definitions. Second, facilitating information sharing across the partner organizations. The third one, assessing IT capacity and integrating data systems to enable data matching analytics. And today, about applying the data to improve performance. Learning community, I'm going to briefly just talk a little bit of detail about each of the previous ones, which brings us to where we are today. We first defined high utilizers, and we define it in a very general way of people who frequently cycle in and out of emergency room, shelters, crisis services, and justice system. We also wanted to start to find the data elements that are important to try to work with this population more effectively. And we created this very simple table. First column is data elements that you would really want to capture and be able to analyze. They include things such as police encounters, EMS events, visits to treatment centers, detox, housing, homeless, shelters, ERs, and so forth. The second column was primary sources of each of those data elements. So you know who your partners are going to have to be. And then third column is just an alternate source of data in case one of the partners is unwilling or unable. You might be able to capture some of these data through other sources. Then we also wanted to define interagency working group partners. And of course, the data sources we just talked about are one way to do it. And this is just a sample graphic of some potential agencies on both the criminal justice side and the health and human services side that could, all or some of these could be part of a work group to try to tackle the problems with this population. Then also we wanted to inventory the kinds of case management systems each of our partners are using and some major characteristics of those systems. So this is a table to inventory. For instance, City Police Department may be using a Versaterms Versadex software, and it's an RMS with field reporting capability. And so by laying this out, it makes it a lot easier for the IT staff and or your vendor who might be charged with developing a data warehouse or data integration solution. In the second session, facilitating information sharing across partners, we were joined by Dr. Faye Taxman of George Mason University, and we discussed the facilitation of information sharing, and part of that included discussion of some obstacles such as privacy laws and regulations, both federal, state, and local, and some exceptions to those to enable the sharing. We also defined the data integration potential solutions, and we just picked 4: data warehouse, data mart, data lake, and federated query. And we talked about the benefits and deficiencies of each of those potential solutions. Data warehouse was our major focus. It seemed to be the one that would best suit the needs of this project. So we prepared this graphic and talked about this is a sample of an enterprise-wide data warehouse. And on the outer circle, you see the contributing agencies, sources of information feeding into it. In the inner circle, you see some of the types of data that is being captured within that warehouse that we're going to talk about analyzing shortly. And we also, in the third webinar, we talked about using the integrated data checklist. That and the program brief are 2 documents that CSG is currently in development and will be ready by the end of the year. The checklist is a tool that basically lays out the steps that you would need to go through to achieve the goal of integrating your data. And by completing the checklist, it helps you prepare for that process by knowing what capabilities you currently have and where the gaps may be. And that kind of information resulting from that will be very helpful if you end up going out to RFP for a vendor to build your integration solution. That would be very useful information. The more information a vendor that's bidding on a solution has about your system, the more fair the price will be, because when you don't know, you add in additional costs to find that information out or to fill the gap. So it's really helpful to know that information before you ask for bids. And then the second one, the program brief, is more focused on selecting the right vendor, knowing what to say when you're soliciting bids from them, what to ask for, and how to avoid driving costs up by asking for things that you don't need because you knew somebody else that bid on that, and you added their requirements in with your requirements, and maybe what they needed you don't need, so you shouldn't waste time and money asking the vendor to build unneeded elements. So today, we want to focus on how partners access the data and what you do with the data. And so first of all, we want to talk about business agreements because, before your partners can agree to share data, contribute data to a data warehouse, and to work together, you obviously need some kind of MOU or business agreement, both about how and why you're going to work together and what information you're going to contribute and how it will be used and controlled and safeguarded. So those kinds of agreements can take up a lot of time in negotiating them, but that process also builds a trust relationship. It really helps you respect each other by hearing each other's needs and concerns. And so it's a very important process to not skip over, and it will enable more trust, which means your partners may be willing to share more and more data as time goes on to the warehouse. And your IT personnel should be involved in that process because they have a lot of the answers to some of the questions that are going to arise in the discussions and can tell you what is possible, what is already, or what can be done, especially around data security and so forth. How partners access data? Well, one of the common methods of controlling access to data and making sure only those that are authorized can use it is an Active Directory. And that's basically an inventory list of who's allowed to access the data, what their role is, what types of data that role allows them access to. It assigns them unique IDs to sign into. So you have audit logs, which will be able to tell you who was in accessing the data, for how long, and so forth. So it makes it possible to accurately and effectively monitor use of the data warehouse and to ensure unauthorized people are either not accessing it or not attempting to access it. You want to task your IT personnel with management of your data warehouse. Even if you have a vendor, you're going to have somebody on the government side that's going to oversee and manage the vendor and their activities. Some of these activities would include cleaning up the data as it comes into the data warehouse, but before it is actually put in with the rest of the data. This is really important so the results and the analysis you do with that data is more real. More realistic because of the lack of unclean data or data that has omissions or errors. That helps maintain data quality. You want to control access. Again, I mentioned the audit logs and so forth. And they should also do other security measures such as either perform or hire a vendor to perform third-party penetration testing. And that's testing to see, are you vulnerable to a hack? And is it easy for somebody to get in? And these are very effective in telling you what you need to do to close those holes so that those kinds of things are not possible. And you also need to report the results of those security things to your governance group regularly, because it's important that they know that it's an ongoing process and there's a continuing effort to safeguard their data and not just a one-time thing when you started. So it builds confidence and trust, which is really critical in getting the data and cooperation you need from the other agencies. The next we want to talk about how to apply people who are high utilizers, their data for system change. And that's what it's all about today, and what Michael will talk about it as they did in Ohio. Applying data will help you shape effective prevention strategies and intervention strategies to meet the needs, because if you don't know a full detailed picture of the problem and at what points interventions will be most effective, it's really just flying blind, and you're just doing things that might make sense, but maybe if you did them at another point in the flow through the system, it may be more effective and prevent downstream interactions or so forth, or upstream. Some mechanisms that make the data more accessible and more useful to your agency, your administrators, your chiefs, are dashboards, of course. And we'll talk about those a little bit more detail in a few minutes. Setting performance measures. And again, each agency will have different performance measures of different things they want to achieve. Sometimes they may be a little bit of conflict between agencies. You know, what one agency wants, another agency, may have a little heartburn over sometimes, because sometimes we're shifting the problem to another agency and away from ours. And customized analytics reports. What data will be required to answer these questions? Well, of course, I think we all know the kinds of data you're already trying to look at manually, and that having that data available in an integrated warehouse will be much more effective. But data warehouse, intake record logs, user logs, referrals, placements, pre and post records of services, number of days in treatment, pre and post, days between contacts, pre and post, meaning pre and post intervention, or maybe after the data warehouse, the interventions you created then, what did it look like before you did that, and what does it look like 6 months after you did that? And I know it's very basic and elementary, but it's really important. And the frequency of law enforcement encounters. And one point I want to make here, we learned this a long time ago in the drug treatment and jails program. Is everybody that Congress just wanted to look at, well, did they commit any crimes after they had drug treatment? And if they did, then it was a failure. And if they didn't, then it was a success. And we all know it's not that simple. So we worked at the University of South Florida, and we started looking at the length of stays in arrest prior to treatment and after, and the level of seriousness of crime before and after treatment. And what we found was a significant drop in severity of crime and in number of days incarcerated, and a longer period between arrests. It didn't all stop and go away, because you're not going to change a lifetime of criminal activity or addiction or mental health issues with 1 or 2 treatment episodes. So we have to be realistic as they look at the ways we are improving things and making them work better. I talked about dashboards. So these are I'm going to show you some examples of some dashboards that Los Angeles County uses. And in your dashboards, you're going to have widgets and graphics to display the data. But they should be designed with to impart information to the user more than look nice. And a lot of people get some people involved in the process that really want to blow their socks off with all these fancy graphs and pictures. And that's okay as long as it's getting the message across that's intended. But sometimes the message gets lost in that. And so you want to keep that in mind as you develop it and work with your developers to do it. You want to make sure that the data is there and available to be seen easily. And they should be built, in these cases, I can't do it on this webinar, but if you hover your cursor over these charts, the data underlying that bar with 54% would show. You see the detail of that data, which also makes even the dashboard very informative. So again, when designing these are just some more sample graphics from the LA County homeless dashboards. You'll usually need an SME, subject matter expert, to tell you what data you need to capture and to make sure you get it in your warehouse. You'll usually need a database administrator to extract the data that's going to be required for the analysis. And most people use, or a lot of people use, a middleware expert to speed up the extraction process to ensure that your widgets and your graphics are readable and easy to understand and update. You can see in this, these are very small. Even on a full screen, they can be difficult to read sometimes. So it's likely that even each agency would have different dashboards, and within the agency, you may have different dashboards because different people with different functions are interested in different information. In the law enforcement example, an agency administrator may be looking at the big picture, you know, crime analysis and where most of the arrests are occurring, and a patrol personnel are more interested in a little more detail about that and only in a certain section of town. And the crime analyst is more interested in the broader impact of statistics that are available. And investigators, of course, have a different view than that. So the nice thing about it is they don't have to be one size fits all. So you can meet the needs of your people with different dashboards that they have input into designing, or at least telling you what they want to show. Here's some bigger screenshots from Los Angeles County. And then this one, it's veterans homeless. So where are the veterans coming from? And the first one is unsheltered, permanent, temporary, institution, or other. And where are they going? And then the gender demographics and veteran service era data there. These are just basic bar graphs, but again, you can hover over them and get the drill down data if you need to do that. Here they tried to show system flow, meaning where they come from and what programs were they in and which ones did they go to. So you have sort of three silos there of that kind of data. And again, you can see there's a lot of data within each of those sections about those various components of it. So an administrator might want to see that on a daily basis and be able to get a feel for where things stand today. They were rushing to a council meeting and they want to get a good quick snapshot of the system. Then again, little analytical examples in their dashboard of what program families access. And obviously it's really helpful there. There you see rapid rehousing is 71%. So very effective small chart to just give you that idea. And where do they go? 60% go into permanent housing. That's really good news there. And a very simple graphic to illustrate that. Here's a little bit more complicated data from their dashboard. Gives you the county level view to show you on the big picture in LA County of where things stand. And then some details about the subpopulations and the trends, which is obviously real important if you're an administrator trying to seek additional funding or identify what you need to do when you see the trends increasing. You know you've got to take some action. So next I want to talk about performance measures. And in creating and managing performance measures, one of the things highlight is that you don't overshoot, you don't do too much too quick. If you're just starting out, you want to set some basic measures that will give you basic information. You might get more sophisticated once you begin using your data warehouse and or bring on some additional talent in your analysts to be able to do more complicated things. But of course, initially you may be looking at process flow, just like we just did with LA County. We were looking at the numbers coming in and where they were going. Some real basic performance measures. So you might see that at 70%, and you might say we want to be at 80% by the end of the year in the placements and so forth. But then you may add on some more complex or detailed measures as you move on. But you want to have some initial and intermediate successes, so you can build confidence in what you're doing and accurately display the information, and then measure the outcomes, of course, with your pre-data. Creating and managing performance measures, some of the data elements that you would want to capture. Again, we've talked about it since the first webinar. And these are obvious things that you all probably look at every day and even in more detail. But again, the number of days of the types of things you're looking at, if it's homelessness, if it's arrests, if mental health and law enforcement encounters, you're obviously looking at those. You want to look at the variance in the outcomes based on age, race, gender, employment status, homeless status. A lot of times they find that homelessness is one of the biggest driving factors in all the above. And so if you can tackle that one first, you might have a lot more impact than if you don't know that, then you just focus on something else and worry about that one later. And the commonality of the encounters. And one thing that came across yesterday, I'm sure you probably saw, is the stepping up call to action, set, measure, and achieve. And in that, they have some measures of 5% annual reduction in average jail population, 10% reduction in jail bookings, 5% reduction in average lengths of stay, and so on. So it's exactly what we're talking about here in setting performance goals. Some of the questions that you're going to ask your analysts to have the data answer. These often become ad hoc queries where the boss walks in or the sheriff walks in and says, I want to know something that's not part of your dashboard data extraction or any of your sample template reports. So you need to go to your analyst or unless you're able to ask the database for that information. And we'll talk shortly about how that can be achieved. But anyway, these are just some examples of have the number of days between systems contact changed since the program began. All the obvious measures that we're all here to try to reduce. And now conducting analysis and reporting across stakeholders for high utilizers. This is all about informing the stakeholder community of what is and what we can do to change, and if we are doing that, then what impact do those changes have? What scientific method do you want to use? That depends on the kind of analysis that and the kind of data you're collecting. You want to use machine learning, artificial intelligence, or data science, which you will want to use as time goes on. You may not want to start with that. Middleware is real important. You don't have to use it. Some data warehouse products include that functionality in their package and includes analysts, but usually you end up with your own analyst, which can have its advantages because they are more familiar with your system and your needs, and it just seems to work out a little better. But middleware is the software that connects to the data warehouse and extracts the data desired for reports, analytics, and dashboards. So it basically does what we've been looking at. It's, again, built on top of the data warehouse, It can do ad hoc query capability. So if you have middleware, you can go in and you can ask the question to the middleware and it can produce that. And some of the advantages of that is it reduces the amount of coding and technical skills you need to be able to get that information out of it, where without it, you would need somebody who could probably code that question to extract that answer from the data warehouse. Middleware vendors more recently are making a significant effort to make their software more user-friendly, to require little or no coding, and to automatically help clean up data. And they have online tutorials, lessons available, which are very good. They're very inexpensive or free if you buy their software, I guess, and can help the novice get a handle on what they need to do pretty quickly. These are just some middleware products that are pretty common. Tableau is known for having advanced analytics and beautiful dashboards. It's just cloud-based intelligence tools. Its online edition provides the same capabilities in the cloud, and it connects to data sources and lets you publish interactive dashboards, and allows data scientists, analysts, and business teams to slice and dice the data as you want. ClickSense connects to data sources to help you discover insights beyond the formal queries, manipulating and retrieving data in the database. So it gives you a little more ability to manipulate data to get the answers you want. You can freely search and explore data and analytics to investigate hypotheses that you might have put forward. It offers robust visualization and collaboration features. Chartio allows you to explore data and build queries using Interactive Query Builder, and can transform data with a mini engine to preview the data pipeline and run transformational queries. Also helps users turn organizational data into charts and visualizations very easily, which hence its name. And then Looker is a cloud-based business intelligence platform that queries and analyzes large data sets, and analysts can define metrics and use Looker ML, which is a simple data modeling language. And it connects database or data warehouses directly without the need to extract the data, and it can auto-generate data model from your schema. So those are just a couple examples of middlewares. Most middleware, as I said, have online tutorials that show you how to connect various files and manipulate the data. Without the middleware, as I said, you have to know more about programming and coding and scientific methods and data science and analytics. So most people, except in larger agencies, probably don't have those skills sitting around the table to be able to do that on a daily basis on their own. But even with middleware, you still need to know what questions you want answered and let the computer discover things using machine learning. If you decide to use middleware, some of your staff should probably take some middleware online courses. They're as cheap as $11 to $12 a course, and people that take them usually feel they're well worth it, that they're not too difficult, and they really help them make more use of the solution. Some middleware can be very expensive, and some of it is affordable. It's like everything else. It just depends on how much benefit you want from it. So if you're looking for a middleware, you want one that has provable features that you want, so they can clearly demonstrate that it does exactly what you're looking for. As with anything you're shopping for, you're always looking within your budget. You're not looking at something you can't afford right now. it's learnable in a reasonable amount of time. You don't want one that, man, the demo was just fabulous, but none of our people are going to be able to figure out how to operate that. It's too complex. So you got to keep that in mind. You don't want it purchased and not providing a benefit. So you want one that allows those with modest capabilities, technical abilities, the ability to do ad hoc queries, in addition to all the basic template reports you might build in the beginning. You're always going to get ad hoc query questions from your bosses. Something happens last night and they want to know, what about this the next morning? And you didn't anticipate that when the vendor was on staff and you built all the templates. So you need the ability to do that. That's a huge thing, and it's something that the product will let you do on your own. It's well worth it. So next I want to talk a little bit about strategies for ongoing review and action. And some of you are probably already down the road from this, so you're already past and done most of this. But again, as I mentioned, you want to start modestly with a few priority questions that you want answered. Make sure that you have the data to be able to answer those questions. You want to obtain the technical capability to extract the data, required data, and test. You want to involve the governance group with your developers and do show and tells with them to show the capabilities, because they need to understand how it works, what they can do and what they can't do with it, so they can get the full use out of it, but not make unreasonable requests that you have to constantly tell them, well, we're not able to do that. So the more you involve them in that kind of process, the happier everybody will be. And add the ability for the governance group members to submit the ad hoc queries as well, because the data warehouse will be used by the group to get basic information that the group wants as a group, in addition to all the agency-specific use of the data warehouse that we've been talking about all day. Frequently asked questions. Just anticipating some questions that people typically have in this area around defining performance goals. You want to define who the frequent users are. Obviously, that's what this is all about. You want to be able to cross-tab frequent users of those services and see where else they're popping up. You might want to use regression analysis to describe what known factors contributed to that circumstance and that appearance in these various services or law enforcement. And identify and describe how the frequent users of both health and law enforcement are streamed into health and law enforcement organizations. You just got to understand basically how an engine operates before you can figure out how to fix it. What performance goals can be set? Are your prevention and intervention strategies effective and efficient? Well, that's what you want to know. So you need to design some goals of, here's what they are now. We're doing 30% of placements and 25% are successful. So obviously your goal may be to double that by the end of the year. Describe the types of health and law enforcement treatments the same individuals receive in the workflow as they move in, through, and out of the health and law enforcement organizations. Identify workflow areas, interactions, stages where law enforcement can make significant interruptions in that cycle and stop the flow by intervening and doing a placement. Who needs to be involved in and what level in order to create these solutions across stakeholders? Well, these are pretty obvious. Your administrators of your various agencies, including hospital emergency room administrators, sheriff's administrators, county jail, homeless shelters, homeless agencies, even recovering frequent users for reality checks. They're often very very helpful in informing future program design of what would have helped, what has benefited them, and what didn't help them that happened to them in their past. County IT staff, sheriff staff, HHS staff, stakeholder groups contributing the data. IT has a lot of answers you're going to need. They're not operational, but they know what the system can do and can't do, and what data they have and don't have, and so they're real important to this conversation. How will the impact the new intervention approaches be assessed? The big picture of what things were before you started your programming and your data warehouse, hopefully we'll be able to give you a lot of the data prior to new programs or interventions that you're doing, or just using your data warehouse in general. And then compare that at periodic phases in the future. Obviously, it takes a while for programs to have impact, so you can't turn it on today and then do a study next week and see what it looks like. You can monitor that, but you got to give it time to have impact. As interventions change and changes are added to the workflow of dealing with the frequent users, you're going to add new data elements to the data warehouse and to your analysis. So it's not a one-time thing. Here's what we're putting in there, because you're creating new data sources and data elements in your new programs or interventions. So you want to make sure you're constantly updating those into the data warehouse so you can get analysis based on that activity. And finally, how often should stakeholders come together to review progress and assess results? That's really up to you. I recommend at the beginning regular monthly meetings at first, because they help increase buy-in and ownership by their involvement. It incentivizes attendees to review notes and prepare for the next meeting and not just forget. It puts pressure on project managers to focus on the month-to-month deadlines and to-do lists and to prepare the show and tell. And it drives collaboration and respect among agencies with disparate missions to work on a common objective. So that's what I would recommend. And with that, I turn it back over to Michael.
Great. Thanks, Bob. Really, really appreciate you and going over all of those notes. It really helps to remind all of us, where we are, where we've been, and where we want to go to. I want to talk a little bit about highlights from the field here in Franklin County and a program that we've put together called, my slides seem to be going in a wonky direction. There we go. Our a frequent user system engagement model. Many of you may be familiar with the FUSE model. It is a model that was created by the Corporation for Supportive Housing, first in New York City and then rolled out to a few other places. It is a time unrestricted housing first model, and you can certainly read a lot more about that on the CHS website. But what's important for us is that we put this together and we said we're going to focus specifically on the folks who are the most frequent users of the jail system. So in order to enter into our program, this was our entrance these were our entrance qualifications. You had to have spent at least 150 days incarcerated in the previous 24-month period. And you had to have had 5 or more jail stays if you were a cis woman or if you presented as trans or gender nonconforming, and 8 or more jail stays if you were a cis male. And honestly, the reason we struck these numbers was if you just looked at the number of people who had spent 150 days incarcerated, it was far more individuals than we could have served. And so paring it down, we took a look at the data and kind of determined what our cutoffs would be for that. But this gave us, knowing that we were going to be able to house somewhere around 40 people. Originally, this program started out as a randomized control trial pre-COVID. And so we thought If we house 40, we need at least 40 in the control group. That's 80. We're going to need at least a couple hundred people in the eligible pool. So that's sort of how we came together and got those numbers. Notice that those are the only criteria in our case to get in. And the reason for that is that unlike many of these frequent user systems projects, which are funded with a combination of dollars, so they get money from law enforcement and the courts, they get money from the homeless shelter system, they may get money from the alcohol, drug, and mental health system, they may get money from the hospital system, they may be patching that together from a variety of places. And so then you're doing a lot of cross-tabbing, as Bob talked about earlier, between all of the different systems and who are your most frequent users across all of those. And you determine what most frequent means based on your own criteria. We were able to fund this program with specifically with dollars that come to the counties from the state of Ohio, called the Targeted Community Alternatives to Prison program. And those were funds that were set up when the state legislature determined that most of the lowest level felons, we have 5 levels in Ohio, so the felony 4 and felony 5 convictions for nonviolent crimes would no longer be eligible to serve time in the state prison system, but rather would be sentenced to the local jail system. And in recognition of that, there were dollars that followed that program to the counties. We knew that if a judge had planned on sending someone to prison and was not able to, they were going to put them in the jail. And honestly, we knew we were going to need bed nights freed up for those individuals. So our part of what we did with the money was to take it and to target these most frequent minor, almost all misdemeanants who were cycling frequently in and out of the jail system, taking up unnecessary beds, unnecessary time, unnecessary processing when jail is really the last place they need to be, and to free up those beds for people who were being put there on longer felony sentences. Also, therefore, notice that because this is only based on jail days, you do not have to be known to the shelter system. You do not have to be known to the mental health and addiction system in order to get into the program. Conversely, you do not have to be sober to stay in the program. You do not have to be employed to stay in the program. It is absolutely a keep you out of jail program that is designed as in the housing first model. Let's get you housed, let's get you stable, and then let's worry about the other services. But we're not going to make housing the prize for you if you've remained sober. We're going to make housing the underpinning for you so that perhaps you then have the basis from which to get sober. So it's that philosophical shift. Looking at the participants to date in the program, there are 20 individuals, as of the making of this slide, there were 20 individuals housed and 22 individuals who were in the control group of the initial random assessment. Among the control group, you can see 9 of 22 were reincarcerated for a total of 521 days. In the housed group, 7 of the individuals have been reincarcerated and spent a total of 235 days in jail. So this does talk directly to what Bob was talking about earlier. If what you want to do is measure simply recidivism or return to jail rate, and you want to get that down to 0, you are going to fail. It really does mean if you're using frequent users of the system who have spent on average 150 days in the last 2 years and been arrested 8 times in the facility, and you are making an impact, bringing that number down from the original, all 42 of these people had been arrested multiple times, bringing that down to the numbers that you see here is a big success, a big step in the right direction. So you can see that we have affected that different change in both the percentage of folks who were arrested substantially shortened the number of days that those individuals spend in our facility when they are rearrested. And here's where the data comes out. The proof is in the pudding. If you look at the folks who have been housed for 3 months, 6 months, and 12 months, 100% of them have retained housing. That's because in the housing first model, even if you go back to jail, we keep your apartment waiting for you. So when you spend the weekend or 4 days or 6 days or 2 weeks in jail and come back out, you still have an apartment to go back to. And so we have 100% of the folks who have entered into our program who have remained housed across those periods of time. As you see, nearly 100% in all cases have maintained contact with case management. The longer folks are engaging with alcohol and drug treatment, they're engaging with mental health, and they are engaging with either becoming employed, securing their SSI, SSDI, and you see the folks there who have increased their income from what they report before the program started. So these are the beginnings of the data. The program has been running for roughly 12, 14 months now. We're extremely happy with the way this is going. We're going to continue doing this, but it is a very, very targeted system designed specifically to take those folks who are using the revolving door that's on the front of the jail and spinning them out of that revolving door into some place that creates more stability for them. So be happy to answer any questions, or I'm sure that the team will share contact information. And with that, I'll throw it back to our host.
Thank you so much, Bob and Michael. We have just a few moments for questions. So the first question that I see is, our jurisdiction is facing serious budget issues. How can we grow our capacity to collect and analyze data with limited resources? I think maybe I'll ask if Bob, you can take a stab at that first, and then Michael, if you want to take have you have anything to add after that?
How do you, could you repeat it?
Of course. So they're saying that their jurisdiction is facing serious budget issues this year and are wondering how they can grow their capacity to collect and analyze data with limited resources.
Well, that is always a challenge. It's a challenge that many people are probably going to experience in the next few years based on what's happened in the past year. I guess Michael might have better insight into that, being in the practitioner world right now, but it depends on where you're at. I mean, if you already have a data warehouse, you're in a better position because data is probably flowing in on an automated basis, and you can do some basic analytics yourself without additional expenditure. If you're not there yet, which is probably the situation that they're referring to, you will probably have to do a lot of this manually, the collection manually. What's most important is knowing what data elements you need to know, sort of like I mentioned in the earlier webinar, where you identify where that data resides. You can collect it manually, and you could create some, basic standard Excel sheets, categorizing that data and comparing it to what you're looking for. But I'll just stop and let Michael maybe add some real life ideas.
I think you hit it square on the head, Bob. We collect a lot of the data that we have manually just because the systems aren't set up and we don't really have the capacity to hire the IT folks that it would take to do that. Having said that, it still does work. It's a little harder to pull it all together, but I think one of the things that does is really makes you take a look at what data are important and help you to not let a massive amount of data get in the way of the information that you're really looking for. We've also had great success with bringing interns to bear on projects like this, and asking every one of these agencies has an internal IT person, and asking them to all just get together in a room and say, what can we do? What low-hanging fruit is there? It's amazing how creative those folks can be, and how much they actually want to work together. So talking to the folks who are actually with their hands on the data sets makes a big difference. At the top line, getting your criminal justice coordinating council or whatever your organizational group is to say that data collection and integration is important to the group helps, I think, because then you have sort of this blanket okay from all of the stakeholders across the board, so that when you go to individual departments, they don't have to say, well, I'm not sure if my boss would like that. You can say, well, your boss has already signed on to this concept. So those are just a few suggestions. But the bottom line answer is that it's not easy. Sometimes you just have to get down in the funk and mine the data by hand.
And if I could add one more thing to that, in addition to the interns, check with your state statistical analysis center. Sometimes they're looking for projects to take on, and local universities and colleges who may have a project, want to take it on as a project and look at something for you along those lines.
Thank you both so much. So we are out of time. If you do have additional questions, please feel free to email me. You can see my email address there. I want to thank you all for joining the webinar today. This webinar will be recorded, and we should have the recording and slides available to send out by email within a week. As a reminder, this is the final session of this Learning Community series. Thank you so much, and have a great day.